My name is Beth Pizarski, and I will be looking at Joanne Duffy's quality caring model. So I've decided to use the 8 caring factors Joanne Duffy describes within her model as my points for my concept map. So at the center of my concept map, I have the nurse's role in caring for a patient admitted for febrile neutropenia. This can turn into an oncologic emergency for an oncology patient, as if their counts are low and they exhibit signs of fever, this can be the first indication of sepsis. So I used the 8 caring factors from Duffy's model to represent this. Starting on the right side, we have initiating a relationship in connection with the patient. This speaks to the human respect in Duffy's model. This is asking the patient how they would like to be addressed, sitting with them and making eye contact while doing an admission database, and not rushing through the process, not being concerned about other patients and other things going on, really being present with the patient. The nurse then needs to explore concerns with the patient. This speaks to working in an encouraging manner. So this would be using active listening and therapeutic communication so the patient can voice their concerns and anxieties and questions about their admission and diagnosis. This speaks to meeting the psychological needs of a patient. The next factor we'll look at is meeting the social needs. This would be the affiliation needs. This would be something related to the patient being concerned about seeing their family members. A patient with febrile neutropenia is put on environmental precautions, generally asking people that are ill not to visit. Children are generally something that will ask families to either avoid bringing in, or if a child is going to come in to see their family member, really just practicing good hand hygiene with the patient so that they're aware and that they can keep themselves protected. So for a patient in this situation, we would make a plan for him to see his family, to engage his children, and be with his wife. So then we'll look at addressing the spiritual distress. So this is appreciating the unique meaning. So each patient is unique and has factors that are important to them. So for this patient in the example, supporting the patient through a crisis and exploring their feelings about their spirituality. We can also talk to the chaplain in the hospital and ask them to come visit, not as a representative of any spiritual denomination, but more just speaking to the general concept and exploring the feelings of the patient through the spiritual unrest. Next, we have managing the external stressors. So this speaks to creating a healing environment from Duffy's caring factors. We would want to bundle the care for the patient to allow periods of rest. Patients that are admitted with febrile neutropenia are assessed very frequently. They're monitored closely. So we want to make sure that when we're going in, we're providing care all at once to allow periods of rest. They're also put on neutropenic precautions. Most of our patients will have private rooms. We'll want to avoid having fresh flowers in the room to avoid any kind of contamination from fungal invasions. We'll want to encourage good hand hygiene. And anyone going in the room that isn't feeling 100% or might be carrying a cold will need to wear a mask. Again, these patients are very susceptible to infection. Next, we talk about the promotion of homeostasis. This speaks to the basic human needs. For this patient, we're going to be monitoring their vital signs and doing an assessment every 4 hours. We're going to want to be checking their blood counts daily, if not twice a day. Really, we want to make sure that they're trending in the right direction, their white blood cell count is improving, and also because of the bone marrow suppression, we can also find that the platelets and the red blood cell count drops as well, so the patient might need supportive transfusions. Additionally, we're going to be administering antibiotics. This is a key concept for a neutropenic patient. Antibiotics should be initiated as soon as possible. Our patients will get a variety of not only antibiotics, but antifungals, really just trying to keep that patient in the best state that we can and working towards restoring homeostasis. Next is looking at the care coordination aspect. This is attentive reassurance. This is encouraging the patient that they will be out of the hospital at some point. Their counts will rebound. A nadir does not last forever. It's just patients respond at different levels. So we will start discharge planning as soon as the patient comes into the hospital. This gives them the hope and something to look forward to of where their health status will get to and what they'll return to. The patient often is asked to participate in this process, so that way we're meeting that patient's specific needs, and it makes it more likely for them to encourage self-motivation. So then we'll look at the teaching aspect within education. This speaks to mutual problem solving, again, focusing on the patient and what their needs are and what's important to them and how we can help to restore that level of health. So giving them the educational materials necessary with discharge on signs and symptoms to monitor for worsening infections or signs of infections, and also preventative care. These patients need to have a good understanding of why mouth care is important to prevent opportunistic infections such as thrush, why they need to have good hand hygiene, avoiding crowds, making sure that if they are out in a crowded area, they're wearing a mask, they're making sure that they're not exposing themselves to unnecessary risks. So Joanne Duffy's quality caring model. There's a lot of information on this slide, so we're just going to talk briefly about it in the interest of time. So starting off with Duffy's meta-paradigm of nursing. This is the 4 key concepts of the meta-paradigm of nursing and how it relates back to Duffy's quality caring model. So the nurse is the one providing quality caring interventions and promoting health. The patient is the one that is experiencing the cared for feeling. This is a very important concept in Duffy's model. The environment is the area that we're producing to be conducive with healing. This can be a variety of places, inpatient, outpatient, the community, just a variety of things that can be done in areas that we can promote healing. And then health, this is the quality caring interventions that are meeting the needs to promote health or return to health. It also is applicable for patients living with chronic conditions to produce quality of life. So the assumptions of Duffy's quality caring model can be broken down into sections. So they relate to what humans are, what caring is, and that feeling cared for. This is an important concept and perception of patients throughout most of Duffy's model. And again, speaking with the propositions, this also relates to that cared for feeling and the relationship that a patient experiences with healthcare providers. So then how Duffy's quality caring model can relate to improvements in nursing practice. It actually gives a way to measure caring practice and assess it and evaluate it to ensure that best practice and best measures are being taken. It gives nurses feedback on the perception patients have about their quality caring and the interventions that they're providing. And it also speaks to multiple levels and applications, such as the quality caring tool that can be used for assessing administration. So managers can have an active role in seeing how their staff perceive caring. Nurses can rate management and what their model is for producing quality feelings of caring in their employees. For me, this is a very important thing because as a manager, I try to encourage patients and staff feeling cared for and appreciated, and I think that this speaks to it and really allows those tools. So thank you very much for watching my presentation on Duffy's quality caring model.